Do you think genotype is important? Children with sickle cell disease are struggling. Parents are equally struggling. Today, I'm going to take you through everything that you need to know about this condition because it is so important. So let me start. What is a sickle cell? Everybody, we have different types of blood cells. We have the red blood cells, okay, which transport oxygen in the form of hemoglobin. We have white blood cells, and even the white blood cells, we have different types. But when we talk about sickle cell, we are talking about a genetic condition which affect the red blood cells, the shells, the membrane of the RBCs are affected, and as a result, your RBCs begin to change their shape. Their shape is changed. A normal RBC is biconcave in nature. It has a surface area back and front, and this allows it to be changing in shape, right? Now, when you have a sickle cell disease, what it means is that instead of your red blood cell having this biconcave spherical appearance, yours is not like that. Yours is having something like, now this is what I'm talking about. This is a normal red blood cell, and when it is like this, assuming this shape, this allows the red blood cell to be able to squeeze itself, change the shape, and maneuver its way through different blood vessels, the small, the big. When you have a sickle cell disease, what is happening is that instead of your RBC assuming this shape, because of the genetic condition where some of the amino acid have been replaced, instead of you having this, you rather have this. And when you have this type of RBC, this does not allow your body, the RBC, to function optimally. And as a result of that also, they break down faster than normal. If you don't have this, or you have a sickle cell disease, when you have this no abnormal blood cells, which is the sickle cell type, they normally stay in the blood ranging from 20 to 40 days. Imagine your blood cells, the RBCs, are supposed to last 90 to 120 days. Now, because of sickle cell disease that you are having or your child is having, his or her red blood cells, majority of them are going to start breaking down as soon as they get maximum 40 days. This has implication for their life, and that is where we are going to start the discussion from. We now know what a sickle cell disease is. You need to understand that it's a genetic condition, and anything that has a genetic predisposition means that once you have it, you can pass it on to your children in future. And that is why it is important that, especially if you are here to get married, please stay with me, married, or you have children who have a sickle cell disease, please stay with me. Let's learn and get your questions answered. My name is Dr. Mauko Felix. Now, why am I talking about sickle cell disease? Every year, globally, it is estimated that up to around 350,000 new children will be born into the world with sickle cell disease. 350,000 newborns will be released into this world and they'll be having sickle cell disease. Unfortunately, these children are going to live their life and suffer, not because they want to suffer, but because probably you, the man listening to me, you, the woman listening to me, you did not do the right thing. And that is why I am here today. That is why I am here today. So that before you say I do, you need to know that your I do can come with consequences, so that you have to make the right decision. Now, what are the issues before you go into marriage? Before I start talking about the signs and symptoms of sickle cell disease, let's look at it at the basic level, the fundamental level. As I said, any child that is born into this world and he or she is suffering in pain, he or she is having troubles, infections, and all those things that I'm going to talk about, it means that you, the mother, you, the father, you committed the first class offense. And that offense is your genotype. Does genotype matter? Yes, it does. Before you marry, you need to know your genotype. Every red blood cell has surface proteins. These surface proteins are what we call the genotype, right? Now, the normal one is the AA. AA. All right, that is the normal one. Any other one is considered abnormal genotype. This is the surface protein that the RBCs carry. All right. Remember, our RBCs, their main function is to transport oxygen in the form of hemoglobin. That means that if you follow love in the name of I am in love and you go ahead and marry without considering your genotype, eventually your child is going to suffer. And not only your child, it is also going to take a financial toll on you. As I said, the normal one is the AA. Let me see if I have a picture of it here. I think I should. Good. We want to deal with it from the roots, the grassroots. Before you say I do, guys, remember this. This is so important. You see the chart at the background, right? You see the chart at the background. These are the genotypes that I'm talking about. The normal genotype is what is considered the AA. The AA genotype. That is the normal one. All right? So what happens? Before you say I do, you need to first know the genotype of your would-be spouse, your would-be partner. Right? Take note of that. The correct one, the best one, is the AA genotype. The AA genotype. When you are AA, your partner is AA, you are okay, you are very compatible. All your children are going to be normal children, normal here in quotes, meaning that they will not be having traits, they will not be having any issue. All right, take note of that. Now, if you are AS means that you are a carrier. Some of your blood cells, your RBCs, are abnormal, but you have enough normal ones also combined. That is the AS. AS and AA, you can marry. That is also very compatible. In the worst case scenario, you give birth to children who are carriers. Let me see if I have some charts here to make this thing very simplified for you. Let me put this here. I hope you guys, look, please, if today is your first time coming here, trust me, be coming here. You learn a lot. Let me just explain from here. Everybody. So, if you have AA, another genotype is the C. Okay? You can marry AC, meaning that you give birth to children and some of them will become carriers. In this case, they are going to be having AC. AC is a carrier state. If you are here listening to me, you are AA. Your girlfriend or your partner is AC. You can do that. If you are AA, all right, or you are SS and you want to get married, the only option that is available for you is AA. You cannot go for any other genotype apart from the AA. Why? If you go for any other genotype, when you are SS, it means that most of your children are going to end up having sickle cell disease and they are going to suffer. Don't make that mistake. If you are CC, I know some of you didn't know about this C thing, but today you are learning, right? There is what is known as CC, AC, SS, and AS, all right? Take note of that. If you're having CC genotype, the only option for you is to go and marry an AA. Any other genotype that you go and marry, because you are CC, you are going to have children who are going to be living with sickle cell disease. Take note of that. You cannot be a carrier, okay, like AC, which is a carrier state, and go and marry another person who is having a sickle cell disease. CC is also another form. Hemoglobin C. We have hemoglobin F, which is fetal hemoglobin. Hemoglobin S, which is the common one, sickle cell anemia. All right. Then we have hemoglobin C. If you are CC, please don't go and marry any partner who is having a C or a carrier in his or her genotype. Why? Your children are going to end up having sickle cell disease. Take note of that. If you are AS, myself, I am AS. If you are also AS like me, I am an AS, which is a characteristic, very normal individual. You are just having the sickle trait. All right. If you are AS, you can't go and marry any other person who is having a trait. Why? With AS, it is going to give birth to 4 children. When you get 4 children, one of them is automatically going to end up with sickle cell disease. It's automatic. It could be the first child, it could be the second child, it could be the third child. You may have only one child, and that child is having SS because you are what? AS, and then the person is also AS. This S is going to cross with this S. It will go like this, and then another S. So you get SS to come in together. So you have to avoid that. If you are AS, you can't marry SS individual. If you do that mistake, what is going to happen? What's going to happen is that if you give birth to 4 children or 3 children, 3 of them can end up having SS. Because of that, you cannot go and marry an SS if you're having an S or a C in your bloodstream, in your genotype. You can't. Hemoglobin C. If you are CC, you are equally a disease. Let's say you have abnormal cells. You can't go and marry another person who is this. All right? It is not possible. Somebody is saying that, is it not a probability? No, sweetheart. When it comes to SS and SC, there is no probability there. Our genotype is the A type, right? S is abnormal. S is abnormal. C is sorry about that. S is abnormal. C is also abnormal. So fine for me, my moderator. God bless you. All right. If you are SC, your partner is SC, and you go and marry, what is going to happen? None of you have a normal genotype, which is the hemoglobin A. Because of that, there is no way you are going to give birth to children who become normal children in quotes. Are you following the discussion? If you are AS and another person, your partner is SS, what it means is that when you give birth, only one of your children can become what we call it, AS, which is a carrier. Most of your children are going to inherit the SS. But if you don't have A at all, none of you, the 2 of you, none of you is having the A genotype. What it means is that there is no way you are going to give birth to children who have an A genotype. I discussed this some time ago, and some couples started having issue. Please, I am not here to create problem in your marriage. I am here to educate you and give you the right information. Use the information the right way. If you are SS or you are AS or you are both SS and you have a child who is having AA, please, I beg, I didn't say anything. I am just talking. That one, you have to, you know what I mean? Either somebody has done you like this, you have to think about it. But that is not why we are here today. I am here to just explain things. Please, if you are here, you are not yet married. Take this very important. Yes, infinite luxury. You know what I mean? You are SS, your husband is SC, or you are AC, and you know, and you have a child who is AA. Please, you have to think. Take note of that. The normal one is this. So as you allow your man to be doing twe with you, CJ, my brother, I don't know whether you are still here. I'm sure you are still here. Before you are doing twe with that woman, twe, you know what I mean? Anyone here, as you are doing the twe, I beg you, ask yourself, where would this lead to? Can this relationship lead to marriage? Can we have children in future? I did cool corner. You did there, my brother. You did there. You see what my brother is saying? You did cool corner. Are you? And so fine for me, meet my junior brother today. You have never met him before. Please, the woman you are knocking, the man you are knocking with, doing ta with. Do you know your genotype? Do you know your genotype? Do you know his genotype? You, the woman also here, do you know your partner's genotype? Some of you are in a futile relationship, and eventually, because you are in love, you become blinded. And you now give birth to children who will be struggling. Now that it is winter in some countries, it is snowing like nobody's business. Canada and some other countries, the snow is all over the place. These children are now struggling because you followed your love blindly. You were dating this man, doing ta, without even taking a bother to know about your genotype. Now you are in so much love that even it has become so difficult for you to come out of it. And some parent listening to me, I'm sure some of you are here. I am not here to scream for nothing. I am here to tell you that even though you have made that mistake, we don't want children to keep on suffering in this world. We don't want children, you giving birth to children and they live their lives struggling, in pain, in sickness, in problems, simply because you made love to blindfold you. Sickle cell disease is very traumatizing, not only to the child, but to you, the family also. You play a role. And that is why Dr. Felix today, once again, I am here screaming on top of my voice that let's say no to sickle cell disease. And saying no to it, guys, it starts from me. Somebody needs to start making the right decision today. The relationship that you are inside, please, if you don't know the genotype of your partner, our message to you is simple. Please, this coming week, take it upon yourself. Go and check. This is very important, especially for those of us who are yet to get married. Those of you who are yet to get married, please go and check it. Go and check it, because I know once you are in love, you are so blind to everything. Even when they are telling you, you are like, I am in love. I am in love. I can't live without him. I can't let him go. I have personally seen in the church where couples came for what do we call it, premarital counseling, and they go through the counseling process. We ask them to go and do their genotype. One is AS, the other one is SS. All right, AS plus SS. Where is AS plus SS? Here, characteristically, they had this one. The woman, I've forgotten. I think the woman was SS, the man was AS. And I was like, you guys can't marry. You can't marry. The man looked at me in the face and said, Doctor, I am in love with this woman and we want to get married. Who can guess what happened at the end of the day? One is, where is it? SS, okay, SS, and then I think SS, one was SS and one was AS. Yes, SS plus AS. Who can guess what happened? They went ahead and still got married. Remember, we only tell you the facts, but we can't force you. Today, it's one of the, it's one of the biggest mistakes they have made, and they are living in regret up to date. Some of you have done that mistake. I beg you, people. It breaks my heart when I see children, innocent children, who are suffering because of somebody's selfish love. And I'm talking to you. You are a mother here. You are a father here. Sometimes some of you didn't know. In the past, there was no much awareness, so we forgive you for that. But in this 21st century, if you are here and you are going to marry, You are dating this man who is giving you money, dating this man who is giving you money, and you are knocking, doing all sort of things, but you have still not checked your genotype. You are heading into a ditch. And this ditch that you are heading into, it is not only you, your child. For the sake of your child, I beg you, go and get your genotype evaluated before it is too late. Don't wait and say, had I known. Is there any sickle cell mother on this platform? Is there any parent here who is having a sickle cell child or caring for a sickle cell child at home? Yes. We will forgive some of you. We will forgive some of you because some of you didn't know. So we will forgive some of you. But those of you who are yet to start family, you have no excuse to sacrifice your unborn children, their innocent love, for your selfish interest, the so-called love in quote. That you think that you are in so much love with this woman, and because of that, even when the truth is glaring at you, staring at you in the face, you still want to go ahead and marry with somebody. You are a career, you want to marry another career. You are a sickle cell patient, you want to marry another person with a career. Please, for the sake of your children, it is worth quitting that relationship. Do you agree with me or you don't agree? I am saying that if you have a sickle cell trait, you cannot marry another person who has a trait. If you are a sickle cell patient, you cannot marry somebody who has a sickle cell trait. If you are sickle cell, both of you, you cannot marry. No matter how you are in love with this man or this woman, please run away from that relationship. End the relationship now. You see, and this is exactly what I'm preaching about today. Awareness. Awareness. And we are filling this world with innocent children who are now struggling to survive. And you agree with me, the mothers, the parents listening to me who have given birth to sickle cell children, you can't go to work sometime. Am I lying? When your children are in crisis, doesn't it affect you? Talk to me in the comment section. When your children are in crisis, don't you miss work? You do. You have to be frequenting the hospital from time to time because of this mistake. I beg you, enough on that. I want to move on to the signs and symptoms of sickle cell disease. What are the signs of sickle cell disease and why do people get them? What are the signs and symptoms of sickle cell disease and why do they happen? Why do they happen? Why do they happen? If your child has a sickle cell disease, normally the first thing that they get is when you give birth to them, within the first 2 weeks or the first month, they get swollen fingers. Their fingers become swollen and reddening. That is known as sickle cell dactylitis. Why do they get swollen fingers? They get them because now in sickle cell, as I explained to you, the blood cells, the RBCs, they carry oxygen to different parts of the body. When you have a sickle cell disease, the blood cells block the blood vessels. Let me change the background so that you can even appreciate it better. I think I have something to illustrate that better. Let me see. Okay, so here, it didn't show the way it's supposed to show. This is the normal RBC. All right, this is abnormal RBC. Now, when you have this going through this blood vessel, all right, and it gets to a place where it is narrow, all right, it can change its shape and squeeze its way through. Now, here, unfortunately, the screen didn't fit. What happens? Because the cells are abnormal, they are going to clog on each other. When they clog on each other, they block the blood flow to the bone and the joints. As a result of that, all right, oxygen is not delivered into the bone or the area that has been blocked. When this happens, your body begins to find alternative ways to what? gets its nutrients. It undergoes what is known as anaerobic respiration. Anaerobic respiration, where your cells breathe in the absence of oxygen. When your cells undergo anaerobic respiration, they produce what is known as lactic acid. When lactic acid accumulates in cells for a very long time, they tend to propel inflammation. Aside that, when the blood vessel is blocked, all right, and oxygen is not getting to that part of the body, what is going to happen is that cells that causes inflammation, known as pro-inflammatory cells, are also activated, and this begin to activate or catalyze what is known as inflammatory processes. So their places begin to swell. So you see newborn babies and their fingers have become swollen. That is sickle cell disease for you. Another one is yellowish discoloration of the eyes, known as jaundice. Yellowish discoloration of the eyes, known as jaundice. Why do you get jaundice in sickle cell disease? It is simple. You realize that from time to time, sickle cell patients, their eyes become yellow. Why is this so? This is because a normal red blood cell is supposed to stay in the bloodstream up to 90 minimum, okay, and a maximum of 120 days. But if you have a sickle cell disease, what is happening is that instead of your blood cells staying in your body, especially the red blood cells, guys, let me take some water. It is harmattan season here, and the weather here is so dry. So my lips get easily dry. Let me take some water. I'll join it. So we're talking about jaundice and why people with sickle cell disease, they tend to get yellowish discoloration of the eye. And if you are a first timer here, you have not given me a follow, please give me a follow. You are going to learn a lot. You are going to learn a lot. You are going to benefit a lot on this platform. Why the jaundice? In a normal individual, your red blood cells stay in your body up to 120 days before they break down. All right? Now, in a sickle cell patient, your red blood cells are now breaking down faster than the normal, and they are staying from 20 days up to 40 days, and they break down. When red blood cells break down, they release their components. All right? We have the iron component, which is the hem. Right? And of course, the globulin component. Now, when they break down also, some other byproduct, I don't want to bore you into that. Eventually, your liver is supposed to reabsorb this byproduct, right? Process them, and then bilirubin, biliverdin, and all that are absorbed and then processed from the RBC breakdown. Because you are a sickle cell patient, and now your RBCs are breaking down faster than normal, the waste product exceeds the liver's capacity to reabsorb and process them. So as a result of that, what is going to happen? The bilirubin, the biliverdin, they are going to be deposited in your blood. They will begin to accumulate in your bloodstream because your turnover is higher than the liver's capacity to reabsorb and process. So the liver is not able to process it. As a result of that, you have accumulation of the bilirubin in your bloodstream. And this is what stains the mucous membranes, especially the sclera, the palm, the hands. If you are a white person, even your skin can become yellow. Please, are you following the way I'm explaining this thing to you? Is somebody getting it? Talk to me in the comment section. Are we following? Are we following? Are we following? Let me know in the comment section. Are we following the discussion? Talk to me, yes or no? Yes or no? Yes or no? Are we following the discussion? Yes or no? Yes or no? Good. Here I try to break things down so that you will understand it better and better and better and better. My name is Dr. Maokofele. So this is why if you have sickle cell disease, you tend to be having yellowish discoloration of the eyes from time to time, because your red blood cells are breaking down faster at a higher rate than the liver's capacity to process the byproduct. And because of that, this byproduct, especially the bilirubin and all that, are now deposited inside your bloodstream, in your blood, and when it gets to your mucous membrane, it begins to discolorize the mucous membrane, and you see jaundice of the eye. Another one is Coca-Cola like urine. Coca-Cola like urine. Those of you who have sickle cell, have you ever experienced this before? Yes or no in the comment section. Or you have a child who have a sickle cell. Have you noticed your child passing urine and it's like Coca-Cola? Who has experienced or seen that? Yes or no in the comment section. Here we like to make it interactive. Any sickle cell patient here who along the way was passing dark urine, as if it is Coke. You have sickle cell disease, or children who have sickle cell disease, from time to time, their urine will become dark like Coke. When they pass urine, okay, it can become very dark like Coke. We call that Coca-Cola like urine. Why? It is the same thing. Your RBCs, when they break down, they release this order, and it can be passed through the urine. The urine initially may be yellowish, very dark yellow. However, as time goes on, it changes and becomes very dark like Coke. All right, like Coke. The Coke that you drink, very, very dark. That is what is known as Coca-Cola like urine, and this is also happening because of the abnormal faster rate of breakdown of the red blood cells. And eventually, some of the byproducts are also passing through their kidney. And it is this that puts children who have sickle cell disease, or patients who have sickle cell disease, at risk of chronic kidney disease, in addition to the anemia. And we are saying that please don't make that mistake of marrying somebody whose genotype is not compatible with you. If you haven't taken a screenshot of this chart, you are yet to marry. Please, this is your guide as long as your genotype is concerned. Please don't do that. Take note of that. I'll go into the kidney issue properly when I'm talking later in the day. My name is Dr. Mauko Felix. Support us in any way that you can by sharing. Invite your friends, learn for free. All right, let them come and learn. And if you have not given me a follow, please click on my profile picture and give me a follow. God richly bless you. Let's continue. Another sign of sickle cell disease that I want you to know is gnatopathy. I'll break it down. You realize that the gum of children who have sickle cell, their teeth are not well arranged. Who has seen that before? Or their gums, like for example, by God's grace, the way my teeth is arranged in line. You children who have sickle cell patient, right? Who have sickle cell disease, right? Or sickle cell patient, majority of them, their teeth are more aligned. Or not only that, their gums are malformed. Why is this happening? One, the gum, the jawbone, the mandibles, they need oxygen. Okay? The more blood flows to it, the more nutrient gets to it, and the well it can be formed. Now, children with sickle cell disease, most of the time you see their teeth and it is taken out, or some of them can't even laugh well. I'm just trying to let you appreciate and understand the condition. Why does this happen? The same thing, because they have abnormal red blood cells. What is happening is that along the way, when their gums are forming, some blood vessels that are supposed to deliver oxygen, nutrient to the bone or the jaw bones are blocked. As a result of that, they have poorly developed gums. And some of them can't even close their mouth. In the worst case scenario, you see their gum, the first front teeth, okay? They are sticking out. They are like this. I just want you to appreciate the discussion. That is why I'm explaining this to you. So that when you see them outside there, you don't stigmatize them. Because trust me, it is not their wish to be that way. But their parents have brought this problem onto them. God bless you. But if you can't, don't also stress it. All right, let's continue. Another one. Another sign of sickle cell disease that I want you to take note of is what? It's a sign or it's also a complication. It's leg ulcers. Leg ulcers. Leg ulcers or foot ulcers. Very debilitating. Why do children with sickle cell disease get ulcers and it doesn't heal? Or they get wounds and it doesn't heal? Is there anyone here whose child has been getting ulcers and the wound finds it difficult to heal? Is there anyone here like that? They get a sore on their leg or on their foot and it's become very, very difficult for it to heal. The reason is simple. For wound healing to occur, you need oxygen, you need blood, you need nutrition for the wound to heal. In sickle cell disease, because of the abnormal RBCs, I have about 15 minutes more. I'll be here and I'll come back later. All right? Because of that, because of the sickle cell that they have, it blocks the small blood vessels that deliver blood to the skin. And when blood is not getting to a particular area, what it also means is that other nutrients and other things that the wound needs to heal is also not getting there. As a result of this is why people with sickle cell disease, when they get a wound, most of the time they struggle for the wound to heal because blood flow to that area is normally being reduced. Somebody says, I see. You didn't know, right? Now I'm happy you understand. Somebody is saying that I see. Come here. Here I teach you like you are in a classroom. Things that you don't get in the hospital, you will get to know from this platform. And my name is Dr. Mauko Felix. Give me a follow. If you have not done that, please give me a follow. You are going to learn so much on this platform. Another sign, okay, another way sickle cell children present is frequent infections. I am telling you all this so that before you say I do, you think about all this. You are not yet married. You are going to get married one day. Before you say I do, please, I beg you, think about all this. Sickle cell children tend to be having recurrent infections. Recurrent infections. Why is this happening? Why is it that most of the time your child who is having sickle cell, he or she is frequenting the hospital? You have to be going to the hospital from time to time. Why is this so? This is so because in sickle cell disease, one of the major complications is autosplenism. What autosplenism means is that your spleen begin to pull the abnormal blood cells, abnormal red cells inside, trying to destroy them. All right? As the spleen keeps doing that, it gets to a point the spleen is destroyed. The spleen is one of the strong areas for what? Infection control. In other words, when your spleen is functioning optimally well, it helps your body to fight infection as part of the reticuloendothelial system. All right? You have the spleen, the lymphoid cells, and all those things. Right? In sickle cell patients, their spleen begin to get bigger and get bigger. If you observe and you have a cell with sickle cell disease, when they lie down and you just put your hand just under the last lower rib on their left side, you see something enlarging out. That is not the liver. That is the spleen. Okay? It will be protruding from the last lower rib from their left side and be moving horizontally across the abdomen. So from here like this to that area. That is the spleen. As the spleen keep enlarging, it gets to a point the spleen undergoes what is known as Autosplenism, it is completely destroyed. When you don't have a spleen, because the cells have destroyed it and it has overfunctioned to destroy the RBCs, which is the abnormal type, and eventually destroy itself, your body has a poor propensity of fighting infections. And this is why sickle cell children, especially, they tend to be falling sick from time to time. More often than not, they fall sick. And it is because you are part of it. You are in love. And because of that, you went and married somebody you are not supposed to marry. And now when your child is falling sick, indirectly, you also be affected because you have to be frequenting the hospital. We are saying that sickle cell is preventable. Sickle cell is preventable. And I am taking it upon myself. Whenever I get opportunity to come here and discuss these things with you. We can stop sickle cell one way or the other. You know you have this genotype. Don't go and marry somebody with this abnormal genotype. All right? I beg you. Very, very important. Take note of that. Good job. You've done well. All right? So take note of that. Very, very important. Now, another sign of sickle cell disease, or what is very common in sickle cell patient, is their forehead. We call that frontal bulging. Remember, everything that I say, I explain the science behind it, why it happens. Frontal bulging. All right? Frontal bulging. Frontal bulging. What is that? Their forehead, the bone here, okay? The bone here, it normally tends to enlarge and widen. All right? Or it can shape like, it deviates a bit from the normal children. A bit, not so much. In most instances, it does happen. Why is this happening? Remember, normally, majority of the cells are produced in the long bones. Right? Most of the cells, the bone marrow within the long bones in the body, that is where most of our cells are produced, including the red blood cells. Because you are sickle cell patient, all right? And guys, just a minute. Just a minute, guys, I'm back. Now, I was telling you about why their forehead tend to widen somehow, or it becomes shaped like that. Most of the red blood cells are supposed to be produced in the long bones, the bone marrow in the long bones. But remember, sickle cell patients have what is known as vaso-occlusive crisis, where they'll be having generalized bone pain. From time to time, your bones will be paining you. Every single bone in your body will be paining you. They have pain everywhere. You even touch them and they are screaming. Every bone is paining them. Why is this happening? This is happening because the blood supply to the bones have been blocked in a way. When that happens, the bone marrow begins to die off. The powerhouse for red blood cell or any blood cell production is the bone marrow. Let me take that again. Why do sickle cell patients tend to have what is known as the vaso-occlusive crisis or the generalized bone pain? Vessels are blocked by the abnormal red blood cells. When these vessels are blocked, oxygenation, okay, blood flow to the bone itself is also blocked, partially or temporarily. When this happens, the bone marrow inside the bone begins to also find an alternative way of breathing or getting food. This alternate way is what is known as the anaerobic respiration. Lactic acid is produced at the end of the day as a byproduct. When your bone marrow begin to undergo prolonged states of to happen, the bone marrow begin to die off. When the bone marrow begins to die, what it means is that one, your powerhouse, which is the bone marrow, which is where most of the RBCs are produced, also begin to be reduced. You start producing less red blood cells. That explains the anemia. That is one way anemia is explained. So they'll be having recurrent anemia. Not only that, the anemia also present because the cells are breaking down faster than normal. Your amount of hemoglobin is somehow related to the amount of RBCs that you have, because you need more RBCs to bind the hemoglobin and transport it. If you have more RBCs, then your capacity of transporting more hemoglobin is high. The lesser your RBCs, which occurs in sickle cell patient, it means that your body does not have the transport for hemoglobin, and they are not producing more of the cells itself. The little that they are producing is also abnormal, and they are also breaking down faster than normal. So eventually, anemia of chronic illness or sickle cell anemia, all right, will ensue. Why do they get these flat bones? Because the long bones are being destroyed. Thank you, Nivi. God bless you. God bless you so much. Because the long bones, the bone marrow inside them is being bent off or are dying off. Every bone in your body try to compensate by creating other places for more cells to be produced. Imagine the long bones, the marrow inside is not enough to produce more RBCs. Thank you so much. Now your flat bones, your ribs, which are all flat bones, your frontal bone and all that, your body begin to stimulate them so that it will use that as another field for red blood cell production. So you see them having this enlargement of their forehead, even their gum also become expanded. All right, because every bone, your body is stimulating them so that they become a source of RBC production, which is not supposed to be the case. Are you learning? Am I making this self-explanatory enough? Talk to me in the comment section. Are you enjoying the section? Are you following the section? Talk to me before I continue. I don't like it when I'm talking to myself. Talk to me. On this platform, even when you have the condition, trust me, by the time you leave the platform, you get so much understanding of the condition. That is our hallmark, all right? God bless you. I make sure that I break everything down to you, and you begin to appreciate and understand why something is happening to you the way it is happening. My name is Dr. Mauko Felix. If you have not given me a follow, please consider doing so. All right, consider doing so. AC is a career. AC is a career. AC is a career. All right, it's just like somebody having AS. When you have AC, it's a carrier state. It's not a sickle cell. The person is having abnormal 3 hemoglobin, and the abnormal hemoglobin is the C part. The normal one is the AA. The C is abnormal. So it's like somebody having AS. If you have AC, that is also a carrier state. I am a carrier. My genotype is AS. And carriers are not sickle cell patients. All right? They are carriers. They are having a trait, but they live a normal life. Let's continue. Another complication of sickle cell disease that I want you to take note. Tamara, God bless you. Guys, let me take some water, okay? The weather in West Africa is not weathering. It's not easy at all. We are in the dry season, Hamatan. We call it Hamatan, right? We are in Hamatan season. When it is snowing somewhere very cold, here it is very, very hot, right? So let me take some water. All right. Another thing that happens to sickle cell patient, before I say this, I've shared the light to somebody, because people need this understanding. You go to the hospital, you go and pay money, they only treat you and you go away. I come here to come and break it down for you, make life simple for you. And remember, if you don't know, there are some of your followers also who don't know. And that is why I always tell you, just share the live stream. Let other people come and benefit. Let other people come and benefit. Thank you so much. Bless you. And for the first timers, we welcome each and every one. Another way, which can be a sign and also complication of sickle cell disease, is hip pain. Hip pain. Hip pain. Hip pain. Hip pain. Hip pain. Now, in our thighs, okay, we have the long bone in the thigh known as the femur. It articulates with the joint socket, the hip socket. We have ball and socket joints in the hip. We have the acetabulum, okay, acetabulum. And the long bone in the thigh is the femur. It comes like this with the head like this, okay. Look at my face as the head. Like that, like that, like that, like that. And this is the acetabulum, like a cap. So it comes and fits inside like this. Fit inside like this. And then this is what makes your hip to be moving. It's a ball and socket joint. Ball and socket joints. What is happening? What is happening? Sickle cell patient will end up along the way having hip pain. Why is this happening? Now, when you have sickle cell disease, the femur bone, the head of the femur, all right, this is the head, this is the neck, and this is the shaft. So it goes like this, goes like that, and the socket like this. So this is the head, this is the neck, and then this is the shaft, which is the one inside the thigh bone. Let me put it that way. When you have sickle cell disease, what is happening and why do they get the hip pain? The blood flow to the head of the femur, which is the long thigh bone, which articulates with the hip joint, is partially blocked from time to time. When this keeps happening, eventually the head of the long bone of the bone within your thigh, which is the femur bone, begins to die off. So eventually this part will begin to wear off. Why? Blood flow to this area has been blocked by the abnormal blood cells, which is the sickle cell, which are supposed to deliver oxygen, nutrients, and other things to the head. Once you keep getting vaso-occlusive crisis as a sickle cell patient, this is going to reduce oxygen, nutrition, blood to the head of the femur, which is the bone within your thigh. So the head will eventually collapse and this joint will become affected. It is not surprising to see sickle cell children who are limping. They'll be limping. They are not able to balance. One leg is longer than the other. Sometimes, unfortunately, it happens to both hips. And the reason why and how it happens is what I have just explained to you. So that child whom you've given birth to, and he or she is a sickle cell child, all right, along the way, if things are not done properly, one leg is going to become longer than the other, because you can be getting septic arthritis of the hip or avascular necrosis of the hip. Avascular means that no vessel, right? No vessel. We say avascular. Vascular from vessel, right? When we add a, means that it is absent. Avascular necrosis. Necrosis is death of bone. So the femur head is going to die. And once it dies, that bone eventually is also going to become shortened. And you find the children limping, right? Limping on that side. This is what happened. Guys, I know you want more, but permit me. I need to be somewhere. I'll be back in the next is 6 7 in the next 2 hours, or let's do 10 more minutes. I'll go there in the next 10 more minutes. I hope you guys are enjoying the section. Remember, I am a specialist medical doctor. If you have not yet given me a follow, please give me a follow. You see how we do the things here. We will, CJ, okay, thank you so much. Thank you. But one more thing, and then we can go on. Sickle cell children, along the way, we start having eye problems. They'll be telling you, I can't see well. Most of them are going to end up wearing glasses. I am taking you through all this so that before you say I do, you think about all this. Is it worth it to sacrifice your children in the name of love? Eye problems. They start telling you, Mommy, I can't see well. My vision is blurred. I can't see well. I have blurred vision. Most of them have to put on glasses because of your selfish interest of love. And of course, I know some of you didn't know. You are forgiven. But those of you who are here, you are dating a man whose genotype you don't know. You are dating a woman whose genotype you don't know. Don't wait until it is time for you to get married. And now you are at a tight corner because you have wasted so much time on the person and it is so difficult for you to let the person go. Note of that. Visual problem. Some of them even go blind. Apart from the hip issue that I've described to you, where they have hip pain and eventually one leg becomes longer and shorter than the other. They can also go blind, or they have eye problem. They can't see well. Why? The same thing. The abnormal red blood cells that they have tends to block at the back of the eye. We have what is known as the retina. The retina. That is what receives the light and then focus it for us. It has small blood vessels there. When you have sickle cell disease, what eventually happens is that these small blood vessels tends to be blocked. So blood flow to the photosensitive area. Alright? The photosensitive area known as the retina. When the blood vessels are blocked, oxygen delivery to the retina is impaired, blood flow and all the other things that the retina needs to flourish is impaired. Because of that, this is why sickle cell patients, majority of them are going to end up along the way having visual problem. They may not go blind, but they may have to get visual aids because the retina has been destroyed. We call that sickle cell retinopathy. Sickle cell retinopathy. My name is Dr. Mauko Felix. I'll be back again in 2 hours. We have a program going on. I need to go and join him. Please, if today is your first time, I am going to come back. Normally what I do is that I treat a topic, I give you everything about it, then we do Q&A session. Our Q&A section, I do free consultations for you where I address any medical issue, whether it's about the topic of discussion or not. I give you the opportunity to come and ask me any question. Maybe your doctor is treating you about something and you want a second opinion. I do it for free for you. That is my service for humanity. And that is why I joined TikTok. However, if you come here and what I'm doing touches your heart and you want to bless me with a gift, please, your gift is also appreciated. All right? I am not a rich guy. And I'm not shy to say it, but I just love to serve humanity. I just love to help humanity. But I'm very comfortable how far God has blessed me, has brought me. That is why I devote my time to be doing this for humanity. When you come, don't stress yourself. If you have a gift, so be it. But if you don't have a gift, come, let's learn. Tap the live stream, share the live stream, and God will bless all of us, right? Thank you so much. I'll be back again and we'll continue with sickle cell, and I'll be talking about breast cancer also today. And if you know anybody who has breast cancer living in Africa, all right, please, I'll be talking about this, but let me project it before I go. Is it on this? Yes. If you know anyone who has breast cancer and is in Africa, please. Oh, it has gone off. I think I have to put it off. It is Dorothy at africancancerfoundation.org. Please let the person reach out to this email address. When I come back today to talk about part 2 of sickle cell and then talk about the breast cancer. I'll make it better for you. Free treatment for anyone who has breast cancer, irrespective of the stage. All right, take note of that. Just reach out on this email address. I'll be talking about breast cancer today. When I come back to complete the sickle cell discussion, we shall continue with breast cancer, and I'll talk more about this. Right? Take note of that. Give me a follow before I go, so that when I come back, you can find me. I am going to end the live stream and join later after the other program, which I'm going to join. Have you given me a follow? Give me a follow before I go, so that when you need to find me on the app, you can easily locate me. If you have not yet given me a follow, please do that before I end the live stream. Do that. I want to appreciate all of you. It is not my wish to end the live stream abruptly, but I need to go and join another program and support somebody. So I'll be coming back later on. And remember, when I come, we shall finish the discussion on sickle cell disease. Then we shall talk about breast cancer. Then we do free consultation. My name is Dr. Mauko Felix. On this note, I want to thank all of you for coming. Thank you so much. 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 I love you guys. Bye-bye, everyone. Bye-bye. When I come back later on, all right? I love you. Thank you. That is what Dr. Felix stands for. Come and learn to improve your health. Diabetes, hypertension, asthma, chronic kidney disease, you name it. I discuss them in detail. Today is about sickle cell disease and breast cancer. I'll be back later. Bye-bye.